Hi, my name is Av Rios and I'm a paramedic with Lansing Mercy Ambulance on behalf of Expert Village. In this clip, we're going to talk about our ABCs. The ABCs are just a way for the rescuers to kind of remember the different steps that they need to go through when performing CPR and checking for responsiveness of a patient. The A stands for airway, the B for breathing, and C for circulation. In the A part of the airway, what that includes is opening up the airway of the patient. Earlier we talked about opening up the airway using the head tilt chin lift and also the modified jaw thrust by using your thumbs and kind of the pinching motion to open up the airway when you don't want to mess with the cervical spine. Once you have the airway opened, you can move on to the B for breathing. The breathing part includes both assessing breathing and giving ventilations. So first, look, listen, and feel, putting your ear next to the mouth, feeling for any breath and listening for any noise while looking down the plane of the chest for any chest rise. Do this for about 5 to 10 seconds. Once you assess that the patient is not breathing, it's important to give a ventilation. Giving a ventilation, again, using our A-OK for holding the mask. What you want to do, maintaining opening up that airway, go ahead and give one slow, deep breath, just enough for chest rise, not too much. Once you have chest rise and you've given one ventilation, you want to make sure you give a second ventilation. Once you've given a second ventilation, you can move on to the C for checking for circulation. You do that by checking the carotid pulse. Don't ever move from one step without making sure you've completed the previous step. Don't go on to breathing until you've opened up the airway, and don't check for a pulse until after you've given 2 adequate ventilations. If for some reason you're not able to give 2 adequate ventilations, you must assume that there's an obstruction of the airway, and you should proceed taking care of that obstruction before you go any further.